Appreciate your time, Professor. What is your assessment of how things currently stand in Australia? We've seen very little community transmission around the country this week. Are there any areas or outbreaks particularly concerning you at the moment, or are you pretty happy with how we're tracking?
Well, fortunately, we're tracking quite well. I mean, over the last 14 days, New South Wales has had 24 of the 28 cases that were diagnosed over the last 14 days. But New South Wales and whole of Australia has had 0 for the last 3 days. So that is a glimmer of hope, because we want to make sure that we have no transmission during our rollout of our vaccine program. As you just showed on television, America is desperately trying to roll out a vaccine program with limited supply and with an enormous risk of that highly infectious variant. We do not want that. So we want to get our outbreaks finished with, over and done with, and then we can roll out the vaccine program with very little risk that we're going to put the virus under a lot of strain. If the virus gets into somebody who's immunosuppressed, it has more likelihood of becoming a variant and changing itself so that it can actually get into us in a much easier, faster manner.
The cases that we've seen arriving in Melbourne for the Australian Open has really highlighted and reminded everyone, I think, of the risks of international travel. We heard from Brendan Murphy this week. He says that we're unlikely to have our international borders open until 2022. Is that a realistic timeline in your view, if we want to try and keep the virus out once the vaccine has started being rolled out? Can you see those borders opening until we get to the point where we achieve herd immunity?
Yeah. I believe that the authorities are being very precautionary, and that's quite right, because we want everybody to be vaccinated, or as many people as possible, because with the AstraZeneca it has a very high level of effectiveness, up to 95%. With the easier vaccine to roll out, the AstraZeneca, it has a lower level of effectiveness at about 70%, sometimes a little bit lower than that, depending on how you analyse the data. So about a third of people may not be protected, and the government will have to decide what it will do about that third. Will it test people to see if they actually need another vaccine, such as Moderna or Pfizer, to help that third of the population become protected, so that when it does open up its borders, you don't have a third of Australians that can acquire COVID and then spread it again. So I think it's a reasonable proposition that we won't be travelling, sadly, until at least next year.
And what do we actually know about the risks of plane travel and how the virus is transmitted on planes?
Well, that one's a very difficult one, because we do know that we've had people coming to Australia that have either acquired it in transit or maybe in the aeroplane. We don't really know, because by the time they get here and they've either tested immediately, they could have had a very, very short incubation period. The average is about 5 days, but it can be as short as 3 or even 2 in rare cases. But let's say 5 days. It can take people a couple of days to get here, or it can take a couple of days for them to realise they have symptoms and then ask to be tested. So it's a possibility, absolutely. You've got a lot of people in a plane. The crew often take their mask off because it's very hard work to have a mask on for 18 hours or more. And, of course, the airflow change isn't as high as it would be on a hospital ward, which is about 12 complete airflow changes in an hour. That's very, very fast. And even if the aeroplanes do have what's called HEPA filters, which are filters that filter out very small particles, including COVID, the air has to get to the filter first. So sadly, it might go past you. You might get a face full of it, or you might go to the bathroom before it's gone through that filter. So we may have to start expecting people to be negative before they get on the plane, so they get tested, go into the plane negative, to have less risk of acquiring either in transit or in the aeroplane.
Just looking at the situation in New South Wales, we've seen today the Premier say that people there will need to wait another week until some restrictions are lifted. They are expected to be lifted significantly at that point, but the hint from the government is pretty firmly that the recommendation for mask wearing will remain. With school heading back in the next couple of weeks, what's your view on whether students and teachers should have to wear masks at school?
Well, I was on a WHO group that developed the mask guidelines, and certainly children of 14 and younger don't seem to be a source of infection. But it would be really important for the Victorian Department of Health to share with us, as soon as they've done the analysis, of all of the kids that acquired COVID during their second wave, were they actually part of a family outbreak, or were they sources for infection at school with other school children? So during our development of our guidelines and looking at the evidence so far worldwide, it would appear that 14-year-olds and younger are not necessarily a source of infection to us. We adults are more of a source of infection to them. But teenagers in middle high school and senior high school do start responding like adults. So now, with 0 cases and a very small risk of infection in the general community, they're less likely to have to wear a mask at school. But certainly if the numbers were high and they were in a hot zone, we'd be saying to that middle high school and senior high school children, please wear a mask to protect yourself and to protect the staff. And I'd suggest the staff wear one as well, but only if they're in a hot zone and we definitely have very active outbreaks.
The problems with hotel quarantine have been well documented. Do you think that we have now ironed out the problems associated with that? We're seeing daily testing of frontline workers, testing of all international arrivals. Are there any other measures you'd still like to see implemented that hasn't been done yet?
Look, I'm really pleased that we've got daily testing of the staff. It's really important because they and their family want to know they're coming back into the household and into the community with very little risk of bringing COVID with them. So that's terrific because that was a problem. Anybody that is a frontline worker, as the passengers are getting off the plane, they all need to wear a mask and they do need to be tested. But one of the problems with using the hotel, which was a great idea as an emergency idea, is that they don't have the airflow change that is required on a hospital ward. Even if it's not an infectious disease ward, that's about 10 airflow changes, a complete airflow change every hour with 100% fresh air from outside. And most hotels aren't built like that. So they could, of course, acquire that level if the engineers went in and fixed the air conditioning. That would certainly help. But these hotels are not built for quarantine, and our forebears understood what quarantine stations should look like away from people, and certainly giving those that are under quarantine a much happier and a larger area for them to walk around and get some sunshine and some exercise. So I do worry about their mental health under the conditions of a single room. And also, if they can get the airflow change up, fine. But as an outbreak manager, I would prefer it to be outside the CBD and somewhere where the aeroplanes can touch down immediately, where the travellers don't have to be transferred again. But it's a work in progress, and it certainly has improved.
Yes, and that sounds like it's going to be another issue that National Cabinet is discussing on Friday, so we'll watch closely what they come up with on that front.